Hey guys, it's Dr. Adil here. Today we're going to be starting a new series called What Your Doctor May Not Tell You About X. So X may be heart disease, maybe cholesterol, maybe chronic pain, which is what we're going to talk about today. So the point of this series is to give you guys a different perspective than conventional medical doctors may give you in the office. So today we're going to kick off with what your doctor may not tell you about chronic pain. Okay, so what is chronic pain in the first place? So most people know when they hit their knee or hit their shoulder, they're going to have some pain afterwards. And sometimes for whatever reason, your body may not heal and it may lead to chronic pain. This is called nociceptive chronic pain. So essentially what it means is there's signals being sent to your brain that there's still pain generated from this local injured tissue. This is in contrast to what's called neuropathic pain. Neuropathic pain is nerve pain, and we don't really fully understand why this happens. Nerves can become damaged, and then there's misfiring of the communication between the brain and those nerves that lead to chronic pain. So neuropathic pain is more difficult to treat, and we don't really fully understand it. So we're going to be focusing mainly on nociceptive pain because there are some new studies that I want to share with you guys about that topic. So when it comes to chronic pain, we use what's called a biopsychosocial model. So what that means is there's a biological aspect, a psychological aspect, and a social aspect that leads to chronic pain. So it's not just about your body's tissue and how it's healing, but it's also about your mental state and your relationship with your body and that chronic pain. So in regards to what we want to focus on today is that chronic inflammation is actually one of the root causes of chronic pain. So one of the most common examples of chronic pain is osteoarthritis. So most people have heard of osteoarthritis as a wear and tear condition of the joints, but we know now it's not just a wear and tear condition, it's actually a chronic inflammatory condition. What that means is there's inflammation in the joints caused by little messenger cells called cytokines. So cytokines send signals that degrade the cartilage in the joint. So these signals are IL-6, interleukin 6, what are called MMPs. So there's all these different cytokine messengers, and what you really need to understand is that these messengers are what leads to degradation or destruction of the cartilage over time and the bone underneath, which is what leads to osteoarthritis. And this is also the pathophysiology of many other chronic pain conditions. So we now know this is where the treatment needs to go, and so that's what we'll talk about next. So there are millions of people suffering with chronic pain, and often there aren't great solutions for them. Back in the late 90s and early 2000s, we thought we had found a solution for chronic pain. This is with the drugs called opioids. So many of you now know opioids are actually not good, but back then we thought they were okay. And so part of the reason for this is because pharmaceutical companies had convinced doctors that pain is a vital sign. And so in addition to your usual vital signs such as blood pressure and oxygen, they're recommending that you measure pain in patients as well and treat that with drugs. So unfortunately, this led to a slippery slope of more and more drugs being prescribed. And what we know now is opioids actually lead to addiction and they lead to tolerance. So meaning eventually they stop working and they lead to more and more medication required to treat the same condition. And so this never actually leads to a long-term solution for chronic pain. All it does is increasing the dosages, which leads to typically more side effects. And we know that opioids can actually lead to earlier chance of dying, which means all-cause mortality. And also it can lead to depletion of certain hormones such as testosterone. So there's something called opioid-induced hypogonadism. In other words, opioids deplete your body of testosterone, and many men don't realize this when they're on chronic pain medications. And again, many physicians don't tell patients this. So I've had many patients who were on opioids and we checked their testosterone and it was super low, and this can actually lead to more chronic pain. And so now we know that opioids are not the solution. So the other things that patients often get are what are called anti-inflammatory drugs, such as naproxen or Aleve, Advil, meloxicam. These are all targeted at trying to stop the inflammation. And as we talked about earlier, inflammation is one of the root causes of chronic pain. So why can't you just be on these anti-inflammatory drugs for life? Again, drugs don't tend to solve the problem when it comes to chronic pain, not only because of their side effects, but because of their long-term risk. And we know that anti-inflammatory drugs can actually deplete your body of certain nutrients, but they can also lead to what's called intestinal permeability or leaky gut syndrome. And then they can also increase your risk of heart disease and stroke. In fact, there's a study that came out last year that suggested that anti-inflammatories cause more deaths than highway traffic accidents. So it's not insignificant, and it's something really important to understand that these medications are not a long-term solution. So if drugs aren't a solution, then maybe it's surgery. So surgery may help in certain cases. For osteoarthritis, they often do knee replacement, hip replacement, they do fusions for chronic back pain. But unfortunately, again, these aren't always perfect outcomes, and there are many patients who are candidates for surgery. And in fact, in cases such as chronic back pain, there's something called failed back surgery syndrome, where about 50% of people, after about 10 years, actually start getting chronic back pain again. Instead of just masking the pain with drugs and buying temporary time with surgery, we need to get to the root cause of chronic pain. So inflammation is a very hot topic, not just because of chronic pain, but almost every chronic disease is linked to chronic inflammation. That ranges from heart disease, Alzheimer's, cancer. They're all really rooted in chronic inflammation. So there's such an interest of research on how we can prevent this from happening. So in regards to my specialty of treating chronic pain and injuries, there's actually a study done last year that showed that patients who had more inflammation in their diet were 42.4% more likely to have chronic pain. And so they measured this based off a chronic inflammation index of dietary food. And based off that, they were able to determine people who were eating more pro-inflammatory foods were more likely to have chronic pain, and quite significant with a 42% increase risk. So it's not just one of those things where, it might be good to eat better. It's actually a very important thing if you are suffering from chronic pain. So what is an anti-inflammatory diet anyway? So nowadays there's so much out there in terms of nutrition. People are saying dairy is inflammatory, gluten is inflammatory, lectins and vegetables can be inflammatory, nuts can be inflammatory. So people just feel like they can't eat anything. So this is very misleading because it's not a one-size-fit approach for everyone. Everyone has different biological variation, meaning that we all respond to food differently. And so you have to figure out what food works for your body. So many people from the Mediterranean area find that a Mediterranean diet works for them. And that's because they've evolved over the last hundreds and thousands of years with this type of diet. And so a Mediterranean diet may be best for those type of people. So a Mediterranean diet is classically high in olive oil, salmon, nuts, and minimally processed grains such as quinoa or pasta. So this may work for certain populations, but again, it may not work for everyone. So yes, an anti-inflammatory diet may be Mediterranean for one person, but it may not be for another person. So how do you figure out what kind of diet works for you? So what I recommend is to actually do blood work and check for inflammatory markers, and then also to check your own body's response to different types of food. So typically this can take a process of about minimum of 3 months. So you can do what's called an elimination diet. If you really do think you are sensitive, or you do think that grains and dairy are causing inflammation in your body, you can remove them for a few months and see if you feel better, and then also check several blood work markers for inflammation, such as high sensitivity C-reactive protein. There's also one called ESR. There's one called uric acid. And these can all give you a picture of inflammation in the body. And then from there, you can figure out, hey, is this diet working for my body? So for example, many South Asians actually do better with what's called a paleo-Mediterranean kind of diet. So what that is less carbohydrates and a more emphasis on higher fat and higher protein. And that's what tends to work better for South Asians. And there's actually a very good book that I recommend to people about that. It's called the Paleo-Ayurvedic Diet. And so essentially what that is combining the latest science in terms of South Asians and what works for them for food. And so personally, what I follow is a Paleo-Mediterranean diet because I am South Asian and I know that's what works for my body. But it may not work for you, so you need to really do a blood work test to monitor how your body responds to the different foods. Presumably, if you are having a decrease in your inflammatory markers and you are feeling well on that type of diet, then that's probably what's best suited for you. One more test you can use to gauge if a diet is suited for you is what's called a continuous glucose monitor, or CGM for short. And so you can order these off Amazon, and then you can eat various foods and see if your body's blood glucose goes up when you consume these foods. And if it is going up significantly, what that means is there's going to be a higher insulin response too. And we know when you have higher insulin, that can lead to more inflammation as well. And so you really want to figure out which foods are going to lead to a minimal blood sugar response using a CGM. So using all those combined different tests and the CGM, you can figure out what diet is best for you. It can be obviously a little bit complicated. And so if you feel overwhelmed, you can work with a good nutritionist or dietitian. But again, there are many dietitians and nutritionists who aren't well versed in this area, so you really have to be careful on finding someone who has expertise. Okay guys, now that you're confused about what to eat, comment down below and I'll help answer any questions you may have. This is just the beginning of the series, so please subscribe and we'll continue to produce more valuable content for everyone.